Molnica Z-FLO fluidized positioners are specifically designed to help reduce pressure injuries and improve overall patient care. Fluidized positioners are easy to mold and conform to virtually any shape. They also maintain their shape when molded to a patient. Let's look at 3 applications for the positioner. The small utility positioners can be used to support the head and relieve pressure on the occiput. Always start with the positioner flat, and always use a pillowcase or thin sheet to cover the positioner. Place the positioner under the head and align it with the top of the shoulders. Mold the positioner into both sides of the cervical spine. This anchors the positioner under the head and creates the proper amount of support for the spine. Continue using the flat part of your hand to mold the positioner up and around the sides and top of the head. Finally, use your thumbs to push down to create a pocket for each ear to protect that vulnerable skin. If warranted, you can further offload the occiput and promote an open airway by molding the top of the positioner towards the patient's cervical spine. Should the patient have a wound on the head, occiput, or ear, then the positioner can be molded away from that area while still providing support for the head. But now, we need to get the rest of the body in alignment using the medium or large utility positioners. Using the draw sheet, turn your patient toward the desired side. Start with the positioner flat and place it between the shoulders and hips of the patient. Have the patient lean back into the positioner. Then use the flat part of your hand to mold the positioner to the curvatures of the body using 3 to 4 smooth movements until the desired degree of turn is achieved. The fluidized positioner lets the clinician dictate the degree of turn, ranging from a small microturn all the way up to large degree turns. If needed, you can hollow out areas for medical lines, tubes, or existing wounds. Tightly tuck the draw sheet under the positioner and patient to secure the positioner in place. Adjust the positioner under the head to keep the body in alignment. To alleviate pressure on the sacrum, start with the positioner flat. Slide it under the patient's thighs until it meets the gluteal fold. Using the flat side of your hand, mold both sides of the positioner towards the patient's legs. Next, mold the positioner towards the sacrum of the patient, creating lift of the hips and pelvis by slightly bending the knees. For zero-turn patients, using a positioner under the knees changes the angle of the pelvis and relieves pressure on the sacrum. To smooth out the positioner, simply fold it in half. Never fold the positioner for use as it becomes very hard. Remember, mold, don't fold. The fluidized positioners can be cleansed using hospital-approved disinfectant wipes. Fluidized positioners are designed for single patient use. However, they can travel with each patient to the next hospital department, care setting, or even home.